Welcome everybody. My name is Dr. Bronwyn King and I'm the CEO of Tobacco Free Portfolios and I'm a radiation oncologist. Today I'd like to acknowledge that it is NAIDOC week and the theme this year is Always Was, Always Will Be, which recognises that First Nations people have occupied and cared for this continent for over 65,000 years. I would like to formally acknowledge this and pay my respects to elders past and present. Today, we are going to hear from super funds, from their members and from experts in health and tobacco-free finance, followed by a panel discussion, and we hope that you will get involved in that. Now, I always have to go over some webinar housekeeping, so viewers are welcome to submit questions today. Now, listen up carefully. If you are using a web browser, you can ask questions or vote on questions via Slido, which you will find in the Q&A section on the right-hand side of your screen. If instead you're on a mobile, you just need to click the Q&A tab at the top of the screen. And please indicate if there's a particular panellist who you would like to respond to your question. If you have any tech issues, please use the Slido app. Now, to kick off, it is my great pleasure to introduce to you Dr. Sandro Di Meo. He is the CEO of Vic Health. He's a medical doctor and a globally renowned public health expert and advocate. Sandro previously worked for the World Health Organization and he was the CEO of the EACH Foundation. He co-founded the NCD-free, that's the non-communicable disease-free global social movement, and established a not-for-profit foundation to improve the health and nutrition of Australian kids. Now, if that's not enough, he's also published many scientific journal articles and he's the author of the Doctor's Diet Cookbook, which is in my kitchen right now. He's also the co-host of ABC TV and Netflix show Ask the Doctor. Thank you so much for joining us today. Over to you, Sandro.
Thanks, Bronwyn. Thanks for such a generous introduction. And hi, everyone. I'd just like to start also by acknowledging the traditional custodians of the land I'm on today, like many of us working from home across Victoria and around Australia, the Wurundjeri people of the Kulin Nation and their elders past, present and emerging. And particularly this week, but every week, but during NAIDOC week, I'd like to also acknowledge any First Nations Victorians tuning into this important session. It's great to see so many representatives from various groups, including the public sector, financial sector, and members of the public joining us today. Vic Health, many don't know or may not remember, but Vic Health was created in 1987 under, in fact, the Tobacco Act. And it was Vic Health's role to manage the buyout of tobacco sponsorship on sports and arts. Because if you think back to the late 80s, it was a time when many of the major tobacco companies around the world were still very prominent on many of our major sport, cultural and arts events. And Vic Health was really actually created in its inception as a world first foundation to end that sponsorship and to allow the transition away from tobacco forever. We continue to call for higher standards of how tobacco companies market, sell and promote their deadly products even today. But of course, a lot has changed since 1987. Tobacco sponsorship has gone from our sporting and arts events, thank goodness, at least here in Australia, and tobacco advertising is banned as it should be. Workplaces and many public spaces are now smoke-free, including large parts of our great city. The legal age to purchase tobacco has increased from 16 to 18 years. The number of adult smokers has almost halved, and branding has been removed from tobacco packaging, a world first and a major contribution again from Australia to the world and to others around the world. But tobacco remains the leading cause of preventable death and disease in Australia, and there is a long, long road to go. Many may think that the war is won. Of course, this could not be further from the truth. And this is why between 2019 and 2023, Vic Health is investing more than $20 million in tobacco control. This includes providing support for tobacco-free portfolios, important work. And I really want to commend the incredible global leadership that Bronwyn has and continues to inspire. I've travelled around the world. I've lived on the other side of the world. And many times I've heard practitioners, policymakers, individuals inspired by and protected by the great work that Dr. Bronwyn King provides. And she's a great ambassador of public health and the contribution we make as a nation, punching well above our weight at the global level. And of course, e-cigarettes are becoming more and more common in Australia. And these are predominantly owned by tobacco companies and contain some of the same addictive and cancer-causing chemicals as regular cigarettes. And this is a major new and concerning area and a major focus of our work. The tobacco industry is still working hard to make their products as addictive, appealing, and available as possible. They continue to reinvent, to obfuscate, to distract, and of course they use various methods, including donations to political parties and lobbying of political parties to continue to try and get, even here in Australia, relaxing of laws around tobacco and particularly around e-cigarettes. They give cash payments and other incentives to retailers to illegally promote their products. And most concerningly, they continue to prey on vulnerable people, families who already face significant barriers to maintaining and achieving good health in countries that don't have the controls that we enjoy here in Australia. In fact, in many countries around the world, and I saw this working for the World Health Organization, they continue to hand out free cigarettes to children. They pay to speak to students at schools, and they continue to use sweet flavors and cartoon characters to get young children hooked on their deadly products. They do this knowing that there is no safe level of tobacco consumption. And when used exactly as intended, tobacco products will cause early death of around 2 in 3 of their smokers. So the fight to protect people from the harms of tobacco cannot be done by any one person alone, though, because the corporations that profit from tobacco remain incredibly influential and powerful and are able to push their products anywhere there is an opportunity to make a buck at the expense of the health of families and individuals. That's why the work of Dr. Bronwyn King and tobacco-free portfolios is so important, and it shows us a way that we can take away some of the power of big tobacco and influence by hitting these big corporations where it hurts their bottom line. So once again, Vic Health is proud to support tobacco-free portfolios' work and their new initiative, the Pledge Stamp. I hope for all those who are attending today representing the super industry that you'll be inspired to make the decision for your company, and importantly, for all those that you ultimately serve, to divest from tobacco and to make it easier for more Australians to choose a super fund that they can trust and trust is doing the right thing. And I hope that super members will consider switching to a super fund that has made a commitment to tobacco-free finance. Together, we can reduce the power and influence of the tobacco industry, and we can save lives, not just here in Australia, but around the world. And on that, I'd like to now throw back to Bronwyn, and just once again, congratulations on your incredible work.
Thank you so much, Sandro. Those are very kind words and very wise words, telling us all about tobacco, not just in Australia, but all over the world. I think that's one area that, in fact, Australians often forget. I think you said the war is won. We almost think that in Australia because we've had such great tobacco control leaders going back decades, and we just don't see that normalisation of tobacco everywhere in the community like we did when I was growing up in the 80s. But we have to remember that tobacco companies are still really busy in low and middle income countries, in some of our nearest neighbours, really trying to promote their deadly products to young people in a way that we would never let them prey on our children. So thank you so much, and we really deeply appreciate the support of Vic Health in all the work that we do. It has been an amazing partnership going on for many years, and we really are very grateful for that. So coming back to this issue of tobacco-free finance, I just wanted to explain to viewers how it is that I got involved in the first place, because I'm actually an oncologist, a cancer doctor. And my very first job after graduating just as an intern was working for 3 months on the lung cancer ward at Peter MacCallum Cancer Institute, which is obviously one of the prides and joy of Melbourne. We are just so lucky to have this great cancer centre right here for us and for our community. And I started out working on the lung cancer unit there. And like all of you, like all viewers today, of course, I knew that tobacco was bad. I knew that it was a really dangerous product. But that 3 months gave me a front row seat watching the absolute catastrophe of tobacco play out on individuals and their families and their loved ones. And even though in Australia we have great medical care and we can offer patients really sophisticated treatments, the problem is that tobacco causes very serious illnesses and it requires really tough, really aggressive treatments. And unfortunately, we can't cure everybody. And I saw that when I was 25 years old, and it really, really left a deep impression on me. And I just realised, gosh, behind all of these statistics and all of these numbers are people, often people who are in their 40s or 50s, who have so much life and love to give, and it's taken away from them because of this one product. And so knowing that, I decided to become an oncologist and really loved my work. 10 years later, so it was 2010, so I'd been a doctor for about 10 years, I've discovered completely by accident that my super fund was investing my money in big tobacco. And like I'm sure many viewers today hearing about this would imagine, I was really disappointed. It just made no sense for me. How could I go to work every day trying so hard to care for my patients and then at the same time find out that my own money was investing in the companies that make the products that were harming them and sometimes killing them? It just made no sense to me. And so right then and there, when I made this discovery, I just thought, that has to be changed. It just has to be fixed. It is such a big problem. And the more and more I learned a couple of different things. When I learned more about tobacco, I found out about the profound statistics. Now, as Sandro said, in Australia, tobacco remains our number one killer. Globally, the world is on track, listen to this one, for 1 billion tobacco-related deaths this century. That's a prediction of the World Health Organization. 1 billion deaths in a century because of one product. I mean, isn't that crazy? So I learnt about tobacco, and everything I found out alarmed me even more. Then I learnt about finance, and I found out that, in fact, it was just totally usual practice for super funds to invest a bit of your money in tobacco. That's just how superannuation worked. It wasn't just my fund, it was actually really all of them. That's just how they'd been set up. And it wasn't really as if super funds were deliberately doing it, which was an important thing for me to understand. It was just the system. And so the system needed to be changed. And so since that time, I set up tobacco-free portfolios, and we have a great team that now works beyond Australia in many other countries. And we have discussions with super funds and with banks and with insurance agencies and all other financial institutions. And we ask them to rethink tobacco. And instead of investing in tobacco or lending tobacco companies money or insuring them, we ask them to instead stop that and stand side by side with the world's health leaders and try to bring an end to this problem. Now, the great news is that Australia has really been leading in this. And Sandro said Australians have been punching above their weight. On this particular issue, Australian super funds really need to take a bow, because Australian super funds were very open to this discussion. And one by one, they all have implemented tobacco-free finance policies. Now, not all of them, but the ones that we've been working with have nearly all done it. And we've been so pleased to see that. Then it started a ripple effect around the world. And in 2018, we decided to try to launch this global initiative on the global stage. And we gave it a name. We called it the Pledge, the Tobacco-Free Finance Pledge. And we partnered with some United Nations agencies, some big ones working in sustainability and working in health and working in sustainable finance. And we were very happy to get the support of Dr. Tedros Ghebreyesus, the Director General of the World Health Organization. And then we launched this initiative called the Pledge, the Tobacco-Free Finance Pledge, at the United Nations 2 years ago. And we've invited financial organisations from all around the world to sign up to this pledge, to say that they are going to help the world bring an end to tobacco by going tobacco-free. Now, there's 154 financial organisations that have signed up to that pledge, including some of the world's biggest financial organisations, and many of them are in Australia. And some news hot off the press from last night is to let you know that National Australia Bank, one of the big four banks in Australia, has just signed the pledge overnight. So we're very pleased to find that. Now, there are many challenges still. This isn't easy work. We're trying to shake up the system and ask people to do things differently, which is always hard. Big Tobacco is pushing back, of course. We had to expect that. And we, of course, need your help in trying to spread the word and really encourage people to insist that their super fund is tobacco free. And it really is just the easiest step that you can take in making sure that the world is more healthy, more fair and more sustainable. Now, many people have asked us over the years, how can I tell if my super fund is tobacco free? And so today we're very pleased to introduce to you a new tool. And I'm going to hand over to my colleague, Dr. Kate Maxfield, and she's going to tell you more about this new tool. So Kate is a medical doctor. She's worked in a whole variety of healthcare settings in Australia and globally. And just this year, she has not just worked in the bushfire health response recovery, but also she's treated COVID patients in regional Victoria. In addition to that, she is the program manager for the Pledge Stamp. Please welcome Kate.
Thank you, Bronwyn. So it's not easy for Australians to find out if their money through their super fund is being invested in the tobacco industry. For them to do this, they need to contact their super fund and ask directly or scroll through the product disclosure statements. And it's just not practical. And it's not just a problem for Australians, it's also a problem for the finance sector as well. Transparency is becoming increasingly important for the finance sector, and particularly for super funds. They want to convey to their members what they're investing in and what they're not investing in. So in terms of tobacco, we've created a solution not just for everyday Australians, but also for the finance sector as well. So that's the Pledge Stamp. So the Pledge Stamp is a tool that recognises the leadership of super funds, but also banks, insurers, fund managers, and other financial institutions that have become signatories of the Tobacco-Free Finance Pledge. And by displaying this stamp, they're demonstrating their commitment to being tobacco-free. The super funds that have joined the program and they display the stamp, you'll find the stamp located across their marketing material, on their websites, on brochures, across their social media and annual reports. The Pledge Stamp itself, which you should be able to see next to me, as you can see, it's a round logo with green, and we've got the twisted cigarette. So that pays homage to other health promotion initiatives like the pink ribbon for breast cancer awareness. And around the side, you can see a dark green olive text. And that really represents the green text from the plain packaging, which arguably has been one of anti-tobacco's health promotion's greatest initiatives that has been implemented in Australia, but also now in over 20 different countries around the world, protecting our children from being attracted to cigarette packaging. So the Pledge Stamp, it's quite meaningful, and we hope it will become a recognisable tool, similar to the Heart Foundation tick of approval, where you look at it and you know what it is. With the Pledge Stamp, when Australians see that, they'll know with confidence that their money is not being invested in the tobacco industry. It's a tool that we're really proud of at Tobacco Free Portfolios, and we've launched it globally around the world. So we've had financial organisations join the program, the Pledge Stamp program, in the UK, Europe, and North America as well. Within Australia, we'll be continuing this year. We'll be increasing the number of Pledge Stamp members. We have a part of the program, so you'll be seeing the Pledge Stamp more and more. Next to the logo, you can see the super funds surrounding it. So those are the super funds within Australia that have demonstrated their leadership by becoming a member of the Pledge Stamp program and displaying the stamp. we had an opportunity to speak with some of the CEOs from these super funds, and we asked them why they went tobacco-free, because there's so many different reasons that you can go tobacco-free. So we spoke to them directly and we put a short video together. So I would like to now present to you just a short video, hearing directly from the CEOs, and the video should play now.
Along with the direct health effects on those who choose to smoke and the associated health costs to society, there are also other factors to consider, such as passive smoking, litter from cigarettes, and human rights issues associated with growing tobacco.
Competitive financial returns and doing good shouldn't be mutually exclusive. And since we couldn't think of one good thing that tobacco provides, it made a lot of sense for us to be completely tobacco-free from day one.
Research over a period of time showed a disproportionate number of our members were dying of lung and associated cancers.
There's no proven safe way to smoke tobacco.
Tobacco use is a leading cause of death and disease globally. Through tobacco-free finance, we are protecting the health and well-being of our people and our planet.
Tobacco has a significant adverse impact on society in terms of loss of life and the cost to our healthcare systems. It's simply not sustainable.
There's no long-term investment case for businesses that can't change their core business if that core business is making their customers sick.
The finance sector has an important role to play in addressing one of the world's greatest public health challenges.
Since we went tobacco-free in 2012, there has been no downside for our members.
If you haven't gone tobacco-free, you really need to think about doing the right thing for the lives of your members and for your long-term investment strategy.
We just think it's the right thing to do. Do it now. It's time to put a line in the sand on a product that has such devastating side effects.
Authentic.
Optimistic.
Accountable.
Proud.
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 Thank you so much, Kate. I really appreciate you putting together that great video. And isn't it interesting to see the word that all of those CEOs chose? I love that. What was it? 5 of them who chose the word proud, because clearly they're on the right side of history. Clearly they are really walking the talk. And I think that it's so great to see these Australian finance leaders do something that's so great for the world. So thank you for putting that together, and it's really good, I think, for the public to have some insight into the journey that the finance sector is going on in Australia and around the world. Now, I'm very pleased to introduce to everybody Tony Wolfe. Now, Tony is here with us today to very kindly share his first-hand experience of tobacco. So, Tony, over to you now. I'd like to invite you to tell the audience a little bit about how tobacco has impacted your life.
Thanks, Bronwyn. I first joined the workforce when I was 15 years old, straight out of school. It was a very heavy industrial workforce where the first day I was there, I walked in and I was the only person there that did not smoke. So straight out of school, it was probably peer group pressure, but yet I thought, well, this is what I've got to do. This is the even our morning break was called smoko. It still is in some places now. So I started smoking fairly heavily at the time, and I smoked for about 10 years. Didn't really give it much thought. I actually stopped smoking when my first daughter was born. She's now just turned 31 years old. So 30 years ago, I gave up smoking. About 18 months ago, I was diagnosed with throat cancer, which I believe was obviously related to my smoking in the past. I had to undergo a fairly intensive treatment program of radiation and chemotherapy. So that was fairly invasive. I had to have a nasogastric tube inserted for about 3 months. I was off work for 8 months, and I lost 25 kilos during that treatment. But yeah, I've come through the other side, and so that's a positive thing. But yeah, it was quite intensive at the time. Daily, I'm constantly reminded of the impacts of cancer. I volunteer, as do my 3 children, all volunteer with Camp Quality. So we see the impacts of cancer, daily, or at least quite often throughout the year. I guess what I'm glad about is that my super fund doesn't invest in tobacco industry. That would be quite difficult for me to support a super fund that did. So basically that's my story, I guess.
Thanks so much, Tony. It's really very generous of you to share that with everybody. And I think, some of those comments you made will really ring true to so many viewers today, especially people who were just in an environment where everybody was smoking when they grew up. It was normal back then in the 60s, 70s, 80s. It was something that, if all your mates did it, people didn't really question it. And I mean, it's amazing to think just how far we've come in that period of time. And despite the fact that you did suffer a cancer, I'm so happy to hear you got through it. I know throat cancer is a shocker. It is really hard, that treatment, because it causes lots of sunburn in the throat area and you can't eat for a long time. And it's so great to see you looking so well today. So thanks so much for joining us, Tony. Now I'm going to ask Vicky Hamilton to come on the line. Vicky is also here to very kindly share her experience of tobacco with the viewers today. So Vicky, over to you.
Sorry, I thought you were unmuting me. Can you hear me? Yep, good. Thank you very much for inviting me to join this. I actually hadn't really thought about it too much in latter times, but after listening to you, Tony, and your journey, it's brought pretty well all of it back to me at this present stage. My father is who I'm talking about today, really. He would have started smoking at the age of 13, 14. Before he was an immigrant to this country. Before he came out, everybody around his age smoked. There wasn't too many that didn't. It was the social thing to do, as Tony told you, when he started work at 15. My father also started an apprenticeship at 16, but he was already smoking. He had been smoking for 2 or 3 years. His father smoked too. So it was a thing that was in the family. It was accepted. And it was, as I said, a social thing to do. And so my father smoked right up until 2 years before he passed away at the age of 67. So that's a fairly long time. In that time, he also worked with asbestos in the industry he was in the power industry in Latrobe Valley. And he got an asbestos-related disease, which was called asbestosis to start with. It later went on to become lung cancer. Now, in that journey along the way, in the 50s and the 60s, Kent cigarettes were one of the very major cigarettes of its time. And a lot of your viewers online, probably their grandparents smoked. And as I said, it was a social thing to do. The advertising around those cigarettes, and as some of your younger viewers probably don't even know anymore, but it was intense. We had the Marlboro Man, and Kent cigarettes was one of them with the micronite filter tip. And the micronite filter tip had blue asbestos in it. And so they not only smoked tobacco cigarettes, but they were also sucking on a filter tip with blue asbestos. So my father smoked Kent cigarettes at one stage. And so when he went on to get lung cancer, he had a combination of cigarettes that he'd been smoking and being exposed to asbestos. Even through the tobacco industry, he was exposed. He went on to make an asbestos litigation claim. And the claim itself, that was seen that my father's claim, a third of that claim was going to be denied because it was caused by tobacco smoking. Now, as far as the tobacco industry was concerned, it wasn't their fault. It was all around the asbestos. Asbestos and tobacco have a synergistic effect, and so you're 10 times more likely to get a lung cancer. But in saying that, so my father's claim was only worth 2/3, not the whole amount of his claim. And I've got to tell you, it's the most horrific death to have is an asbestos-related lung cancer. So I think that's pretty well it in a nutshell.
Thanks so much, Vicky. Look, again, it's very kind of you to share such a personal family story, and the way you said that your dad started smoking when he was 13 or 14, that really was the norm back then. And you know, it's just so great that we've done so many more things since that time to really protect people from tobacco, so that is a very unusual thing these days. As Sandro said at the start, though, it's whilst in Australia we've made lots of progress, unfortunately we haven't seen that all around the world, and so this really is just a story that's playing out in various chapters all around the world at different times. So now I'm going to invite everybody back. So I'll invite Sandro and Kate back, as well as Vicky and Tony, and we're going to go to the Q&A section of today's event. Again, please send in your questions. We've already got quite a lot coming in here on Slido. So people seem to have worked out how to use that. For those of you who haven't, if you're on a web browser, you go to Slido in the Q&A section on the right-hand side of your screen. If you're on a mobile, there's a Q&A tab at the top of your screen. And while some of those are coming in, I'm just going to kick off. If I can go back to Tony, I just would love to hear your thoughts on, you know, how does it feel knowing really what tobacco does to people firsthand? How does it feel knowing that your super fund is now tobacco-free?
It's quite difficult to imagine actually why they would want to invest in tobacco. So when I think about it, it's my money, and they're using my money to make money for me, but also for the superannuation company. But why would they be investing in something that's detrimental to their mental health? So the fact that they aren't even be a question really, but I think that it gives you great comfort knowing that that your money's being used wisely, I guess.
Fantastic. And Vicky, can I pose the same question to you? How does it feel for you? Because I believe your super fund is also now tobacco free.
Yeah, I didn't know until Kate asked me, what super fund are you in? And I told her, and she said, oh, good news is that that's a tobacco-free fund. And I went, well, that is fantastic, because I wouldn't even know, and I would believe most Australians would not know where the money is invested in their super funds. So, you know, I would be horrified to find out that my super fund was invested in James Hardie products with asbestos. So, and I had no control over that other than to probably opt out of that super if I knew, and go to another one that was socially conscious of those sort of things. So I was delighted, quite frankly, that I'd actually was in the right super fund to start with. So yes, and it is important that a lot of companies become socially aware of what they are putting their funds into and the sort of impact they're going to have on communities right around the world. This is a very important thing, and super funds have a lot of money to spend, so they accumulate that money over a person's lifetime. So it is really important that that money do good work out in the community, not just sitting there making funds. I would rather take less in my super fund if it's doing all the right things than to have a super fund that's destroying the earth and destroying people's lives.
Well, the good news is that on that point, actually, Vicky, it turns out that in the last 3.5 years, tobacco shares have significantly dropped in value. In fact, in 2018, the tobacco sector was the worst performing sector on the market globally. So actually, if you're tobacco free, your fund is actually doing great, not just doing great things with your money, but it is in fact making you more money. So it's a win-win, which is really important to know, because some people are really concerned about that. Is there going to be a financial hit if they go tobacco free? And it's so reassuring to know that is not the case. In fact, you're far more solid and secure financially if you're tobacco free. So at Tobacco Free Portfolios, we worked with one of the biggest pension plans, in fact, the biggest pension plan in Europe, and they got rid of all of their tobacco stocks, and they did an analysis of that. And after 1 year, they were 700 million euro better off because they got rid of tobacco. So I think it's a good message to get out there to people. We're not asking you to take a cut. We want you to have a very solid and comfortable retirement, and we know that's so important to people. But actually, you can have a solid retirement and be tobacco free at the same time. So I'd like to go to Sandro now and ask Sandro, Vic Health has been such a champion of all things sort of anti-tobacco for such a long time. But I just want to ask particularly about this pledge stamp. I'm going to sort of model it here because I've also got it behind me there. Although I haven't quite managed, Kate's got a crown thing going on, which, I haven't quite managed to do that. But how does this pledge stamp fit in with Vic Health and other initiatives that you've supported over the years?
Yeah, thanks very much, Bronwyn. Well, I mean, I think a strength of the Vic Health approach has always been that we can be comprehensive, we can be highly strategic, and we can be long-term. We're an independent statutory authority, but we are funded we're funded from the taxes of mums, dads, small businesses, big businesses across the state of Victoria. And so we take very seriously that our mission, our focus is improving the health and wellbeing of all Victorians, and so this fits really perfectly with our focus and our strategy. We're coming towards the end of a 10-year strategy where reducing the use of tobacco products and safeguarding Victorians has been a key pillar of that, and this complements other work that we do. So there will be no silver bullet, there'll be no single lever. We do still need to continue to invest in things like the QUIT program and QUIT Victoria, or working with our medical partners in terms of upskilling and really empowering the medical professionals. We need to work with our partners in the social service sector, because we know there is such a social gradient and such a health equity gradient with smoking, and particularly with the tactics, the predatory and pernicious tactics used by industry, towards those who already face greater barriers to achieving and maintaining good health. But I think for us, this is a really important addition to that portfolio, that comprehensive approach to reducing tobacco use, ending tobacco use, hopefully one day, and improving the health and lives of Australians. Because what it allows is for people to really be very clear. It's that tick of approval by a reputable authority that says, you are putting your money in the right place, where it's not only going to give you strong returns, but it's also going to safeguard your health, your future, your health, and the health of those around you. And I think in a busy world where we have to make lots of choices every day, having a pledge, having a clear stamp like this is a really significant addition to what needs to be a very comprehensive, long-term and really multi-lever approach to addressing tobacco and reining in the tobacco industry.
Thanks, Sandro. There's some really great points there. I'm just going to go to you, Kate, and then I'll start on our Slido questions. So, Kate, I just wanted to ask you, what do you do or what should our viewers do if they find out that their super fund is investing in tobacco? What advice have you got for them?
Yeah, look, I think it's really important that Australians are asking this question of their super funds, Because as you were just saying before, Bronwyn, there's really no reason that super funds still should be investing in tobacco companies. There's no financial reason. There's no the huge health impact on our world. So I think the first step to do is to contact them and ask them why they're still investing in tobacco. On our website, www.tobaccofreeportfolios.org, we do have a letter that we've created that you can take and send that through to your super fund to help ask that question.
Fantastic. All right, now I'm going to start kicking off with these. I've got my Slido thing here, so I've got all my questions. The top one here is how many or what proportion of super funds don't invest in tobacco? And I mean, I might take that question myself. So in Australia, it's been more the number that we've focused on. So in Australia, we're aware that there's around about 45 super funds in Australia that are tobacco free. Now, it's hard to keep up because there's been a big merging tradition going on recently. So many of them have merged and merged. So what we've done, rather than count the number of super funds, we've counted the amount of money that they control. And in Australia, super funds that control a total amount of about $1.5 trillion of Australians' money is tobacco free now. So it is many funds, but it's important that you look up your fund and check out if they've got this pledge stamp. But globally, many people would be really interested to think that globally, only about 10% of all the super funds in the world are tobacco free. Isn't that crazy? 10%. Now, Australia's really done very well on this. We're not quite there. There are some laggards out there, but globally, it's actually still right at the start. And for Kate and I and the rest of the team, when we travel overseas, we actually have to really reset and rather than speak in the way that we do in Australia, where tobacco free is becoming a really normal decision, we have to go right back to the start and try to convince people to be like the first or the second in their country to make that decision. So it's really variable all around the world. Now, the next question, I'm actually going to ask Sandro for some comments here as well. What pushback tactics have Big Tobacco been using in this space? I can talk about finance, but it might be interesting to hear your views on what Big Tobacco have been doing otherwise around the world, because as you explained in your introduction, the behaviour that we saw in Australia many years ago is still being exhibited, but just not on Australian shores.
Yeah, absolutely, Bronwyn. It's a great question. And I mean, you could have a whole session just talking about the dreadful and completely unethical behaviour of the tobacco industry. I think they really write the playbook and they reinvent it every time, whether it's handing out cigarettes to, go back 50, 100 years, handing out cigarettes to soldiers, whether it's, including cigarettes or paying to get access to and endorsement by the medical community in the 50s, whether it was obfuscating and creating basically fake science and fake news long before that was even a word or concept we thought of. But even today, as I said before, tactics like lobbying and political donations to try and influence political decisions around the world. They get access to children and schools to be able to push their products from an early age. But they also do other very sophisticated things. They do things like create brands because they can't advertise their tobacco products in many countries. So what they do instead is create a clothing brand, or they create some other brand that speaks to the lifestyle that they have tried to create around these products, and keeps the brand and the name alive, even in a time when the products themselves are no longer branded or advertising is banned. The world of digital marketing and digital advertising and using even product placement in things like movies, in social media. I mean, really, if you can think of it, they've done it, they've tried it, they're doing it. They will find every way under the sun to get around whatever laws are put in place, and to reach more people, particularly those who are already facing enormous barriers to achieving good health, and to try and get them addicted on these deadly products. And that's why it's important that just as they keep finding new ways and they never give up, we can't either. There are more smokers on the planet today than there were 10 years ago. That's largely in low and middle income countries. But what we do in Australia not only, I think, sets a benchmark and has done, but it also gives protections. We have to remember that it was us fighting litigation at the international courts that gave protections to other countries to follow our steps in implementing taxation measures, other fiscal policies, and also things like plain packaging. We could afford to defend it in the courts. We could afford to defend it all the way up to the global courts, and ensure that there was that important win for public health here in Australia. But by doing that, it set a precedence that others could then follow and use the protection of our hard-fought win to protect their populations in countries where they're maybe not able to take those same actions because they simply don't have the money to be locked up in courts with these tobacco companies suing countries for protecting their citizens, which they will do and they will continue to do.
It's kind of breathtaking, isn't it? I think you're right. We need a whole session just on this to add in there. Just in recent years, especially this year, because the whole world is now talking about sustainable finance and it's become a really mainstream conversation piece, we have noticed that Big Tobacco have tried to join every sustainability initiative under the sun. They've tried to adopt the words sustainable. They have really tried to promote themselves as sustainable organisations, which of course, according to us is just totally...
Well, you can't think of a product or an industry that could possibly be less sustainable financially, morally, culturally, or environmentally.
There it is, exactly. And I mean, on the environmental front, there's been a lot of coverage about the fact that cigarette filters are the #1 ocean plastic. And I wonder if viewers are aware of that, the #1 ocean plastic. Even if I went back 2 years, I think I would have said it was plastic straws or bottles or bags, but in fact, it's ocean plastic. So there are so many different angles where tobacco just totally fails the test. The other thing they've done, though, is they've managed to lure some sustainable finance experts, global ones, to become lobbyists for them. And for us, they've done that, directly against this pledge because they're not very happy about all of the support that this pledge is getting all across the world. And they've also managed to sponsor a whole lot of big organisations. So sponsoring the Financial Times, the Wall Street Journal, Harvard Business Review, you name it, they've been sponsoring all of these publications, which is probably as a result of COVID because people have lost funding from other sources. Tobacco have stepped in to try to really boost their image. So they are pushing back really hard, and it's certainly just this never-ending task. Now, I'm going to go quickly to Tony again and just ask, Tony, do you have a message for school leavers today? It's coming up to the end of school. We've got kids leaving school, teenagers might be seeing this social media advertising that Sandro mentioned. What is your message for these kids who were in your shoes, who are now in your shoes from many years ago?
While I don't try to make excuses, when I was leaving school, we didn't have the information available to us that we do today. It's a long-term decision, and I know that's difficult to comprehend, that something that you do today may impact you. And in fact, it was over 30 years before it impacted me. And that seems like forever when you're young and carefree but I now have 3 grown-up children. I've got 2.5 grandchildren that I so enjoy spending my time with. And very nearly didn't have that opportunity. So while it's easy and it seems not to have any impact immediately, just consider, if you can, the long-term consequences. And just further to that, Robin, when you're talking about Australia versus the rest of the world. I spent a couple of years ago, I spent 3 months in Italy and could not believe the amount of people that, as part of their normal life in restaurants, in closed areas, it's still so commonplace, and it's there's a long way to go, and I think we are setting the benchmark, and I'm really so encouraged by that. So the message to school leavers, while it's difficult to pinpoint now, it's such long-term effects that it'll get you in the end.
Yeah, thanks, Tony. Really wise words there. Vicky, over to you. I just was wondering, if a super fund is having this discussion right now, should we stop investing in tobacco? Should we sign up to this pledge? Should we display this pledge stamp? If you were in the boardroom with them while they're negotiating this discussion, what message would you have for them today?
What a wonderful question to ask me. I definitely would be their social conscience, and I would be telling them that it's the best thing that you could ever do for everybody around you and the whole country. The best thing Australia ever did was plain packaged tobacco cigarette packets, and it has had a market effect in Australia, as we all know, and it can have that same effect overseas as well. And any super fund that's thinking about being a socially conscious super fund, I highly recommend you do it from the citizens of Australia.
Love it. Thank you, Vicky. That's a great message. I hope that they are listening today. Now, a few more questions here. Someone has asked, what's a reasonable time frame for change for super fund to actually go tobacco free? Now, that's a great question. We've now worked with hundreds of financial organisations from all over the world. For a super fund, usually I would say it takes around about a year, maybe a little bit longer, but it depends on how complex the investments are structured. But it does take some time. We've always said the really crucial thing is making the decision. Whether it takes 9 months, 10 months, 11 months is really not important. It's about that decision. It's about that boardroom meeting where Vicky's going to tell them exactly it's time, exactly what to do. It's time to make that decision. That is the crucial moment. And it does take some time to roll out after that. Another question here that's got a couple of thumbs up. Is super funds also invest in organisations that provide services to big tobacco, like newspapers or advertising firms? And again, I might just take that one myself, if I may, because it's absolutely true that there's a whole infrastructure around tobacco to get it to the actual person who smokes it. And when we work with super funds, we really ask them to cut off the tobacco manufacturers. And that's simply because they're the ones where there's just no room to move. There's no way they can improve. There's no way that they can change, because it's the core business of manufacturing tobacco that is the problem. And we do have a bit of a different view for other elements of the supply chain of tobacco. So if you're, for example, in a paper packaging company and you're making paper, we would argue that it makes more sense to sit down with those companies and ask them to make paper for something else. Or if you're a retailer, it makes more sense to sit down and say to that retailer, look, it's great that you're selling all these fruits and vegetables, continue with those, but could you please stop selling cigarettes? So we feel like there's different productive ways of interacting with companies in other parts of the supply chain. So we really do focus on just tobacco manufacturers and producers. Now, another question here. I might ask Kate for this one, if I may. There's a question that says, what's the first step that super funds can take if they want to sign up to the pledge? What are practical things for them to do?
So I'll just unmute myself there. Well, the first step is to make the decision to go tobacco free. Once they've made that decision, the process is really simple. So if you go onto our website, you'll find the link to become a signatory of the Tobacco Free Finance Pledge, and we'll be in touch with you as you submit the form and the process, and to join to become a signatory. So the process is very quick and very easy. The hardest thing, is to make that decision.
Great. And we'd be very happy to hear from any super fund out there that wants more information. We're very happy to work with you to make sure you feel comfortable with that decision and to help you through the process. I have a question here from Matthew Rimmer that says here, in McVeigh versus Rest, so Rest is a super fund, there was a settlement of litigation over how Rest was handling the climate risk in their portfolio. And he's asked here, should action be taken against funds that are failing to address tobacco risks? Now, I think that's a very interesting question, and it's certainly not something that we have seen happen before anywhere in the world. But I think that case against Rest really showed that it is time for financial organisations to step up to the plate and realise that they must consider things that once upon a time were considered to be not topics for them to discuss. So once upon a time, super funds really thought, they just need to focus on the financial side of things. But in fact, there's a whole raft of issues that are now on super fund agendas that were never there. So they are talking about climate risk, they're talking about tobacco, they're talking about ocean plastic. It's really important that they talk about diversity, gender diversity. It's important they talk about First Nations people. In the US, financial organisations are talking about Black Lives Matter. Everyone is talking about COVID and the best way that they can manage the risk that COVID poses to the financial outcomes for their members and the world that we're building for members. So I think that legal case is very interesting and something that has got the super funds, really looking very closely. And now I know that the clock is just ticking away here so quickly, and I'm not going to get through all of these questions. I can't read them quite quickly enough, but I might just ask everybody for maybe if they're keen to just have a final comment. So Tony and Vicky, thank you so much for joining us today. Is there just a final message you'd like the viewers to hear from you today?
Look, just basically, once again, I had no idea till I spoke to Kate that my super fund was tobacco free. So even just to ask the question, I think is an important first step. So yeah, if you're not sure, ask the question, and if your super fund's not tobacco free, then consider what options you can take from there to get them to take the pledge, or maybe look at a different super fund.
Thanks, Tony. And Vicky?
I encourage everybody that's online today and all their family and friends to ask the question where their super fund is and what it's actually paying into. And if it turns out they are tobacco, then start asking the questions, are you changing? Because if you're not, I'm going to change my super to somewhere else that is doing the right thing. And hopefully with that sort of a push from everyone, it will happen organically.
That's right, Vicky. In the end, it is your money and your choice. That's absolutely right. Kate, just some final words?
Yes. So, look, there's no good reason to still be investing in tobacco. And as we've heard from Tony and from Vicky as well, members want a fund that does not invest in tobacco. It's a really easy process. And to all super funds, we would encourage you to apply for the Pledge Stamp membership. And I look forward to hearing from you soon.
And finally, over to you, Sandro.
Thanks very much, Bronwyn. Look, I think everything's been said. I just echo the great words of Kate, Tony and Vicky. For super funds, apply for the pledge. And for anyone who has a super fund, ask that important question and demand a good answer.
Thank you. So thank you so much, everybody. So I'd like to now give my formal thanks to Dr. Sandro Di Meo and the whole team at Vic Health who've been working very hard to help us put this webinar together today. Thank you to Dr. Kate Maxfield for all of your hard work, and I really love that video of the CEOs of the super funds. Thank you so much, Tony and Vicky. It is very generous of you to share very personal stories, and it really does remind everybody that behind every single statistic is a person, is a family, and that extended network where that ripple effect of tobacco continues to have an impact. And we really, really hope that we can bring an end to that. And to all of the viewers today, we really encourage you to interact with your super funds, ask the question, are you investing in tobacco, and really insist that they're tobacco free. Look for this pledge stamp. We're really hoping it's going to become a well-recognised symbol and will give some confidence that your money is not going to big tobacco. So a few people have asked for contact details. We do have a final slide coming up where our contact details will appear. We're also very easy to find on, if you Google us via our website, LinkedIn, Twitter, we're very easy to find and would love to hear from anybody further today, and especially to anyone who has a question that I wasn't able to cover. And that's really it. I certainly wish you all the best for a great day, and I hope that you all stay healthy. Thank you.